Assalamu alaikum warahmatullahi wabarakatuh. To carry on with the lectures of the thorax, I'm going to discuss in this presentation the anatomy of the lungs and the pleura. I'm Dr. Dalia Saleh, professor and head of anatomy department at Mansoura University, Egypt. In this presentation, I'm going to discuss the following objectives. First, I will start with the pleura and discuss its development, divisions, and recesses. And then I will talk about the lungs and describe the anatomy of their surfaces and hilum. And then I will discuss the surface anatomy of both lung and pleura, their nerve supply, blood supply, and lymphatic drainage. To start first with the development of the pleura, here in this picture we can see the two pleural cavities and the laryngotracheal tube. Consider the pleural cavity as an inflated balloon. Then two lung buds appear from the laryngotracheal tube. Each lung bud will invade or invaginate the pleural cavity, and with further growth, the pleura will fold upon itself into two layers. The layer that is close to the lung bud is called the visceral pleura, while the outer layer is called the parietal pleura. And the space between these two layers is called the pleural cavity. With more and more growth of the lungs, the pleural cavity becomes a potential space which lies between the visceral pleura and the parietal pleura. The reflection of the parietal pleura from one area to another area, we will call it the recess. We can see here the reflection of the diaphragmatic pleura to become the costal pleura forms the costodiaphragmatic recess. We also can see here in this picture that the visceral pleura and the parietal pleura becomes continuous with each other around the lung root. So what is pleura? It is a double-folded serous membrane that surrounds each lung. It is divided into parietal pleura, which lines the thoracic cage from inside, also covers the diaphragm and lines the mediastinum, and a visceral pleura which lies close to the surface of the lung and even dips inside the lung fissures. The space between these two layers is called the pleural cavity. The pleural cavity contains a very thin film of fluid. This fluid will help in sliding of the visceral pleura over the parietal pleura during respiration and also keeps the two layers intact, and this will always keep the lung inflated and prevents its collapse. We have what is called pleural cuff. It is where the visceral layer and the parietal layer of the pleura become continuous with each other around the lung root and hilum of the lungs. Extending from the pleural cuff downwards, the pleural ligament. It hangs down as a loose fold to allow the movement of the pulmonary vessels and bronchi during respiration. Let's start first with the parietal pleura. Superiorly, it extends to the root of the neck just above the first rib. Inferiorly, it extends down to the level just above the costal margin. And medially, it is related to the mediastinum and the structures lying there. It is further subdivided into the following areas. The costal pleura, which lines the thoracic cage, thus it is related to the ribs and the intercostal muscles. Diaphragmatic pleura, which covers the thoracic surface of the diaphragm. Mediastinal pleura, which covers the mediastinum or the structures that lie at the middle of the thoracic cage, and cervical pleura, which extends up into the root of the neck. So we can see here the costal pleura related to the ribs, intercostal spaces, and intercostal muscles. Diaphragmatic pleura, which covers the superior surface or thoracic surface of the diaphragm. Mediastinal pleura, related to the structures in the middle of the thorax or the mediastinum, and cervical pleura, which extends up into the root of the neck. Then we have what is called recesses. We have the costodiaphragmatic recess. It lies along the lower border of the parietal pleura, where the costal pleura reflects to form the diaphragmatic pleura. Another recess is found here is called the costomediastinal recess. It lies along the anterior border of the pleura, where the reflection of the costal pleura to become the mediastinal pleura. For the anatomy of the lungs, let's start first by talking a little bit about the anatomy of the trachea. It starts at the larynx and travels through the upper part of the thorax and ends at the level of the disc between the thoracic vertebrae number 4 and the thoracic vertebrae number 5. It's about 10 to 12 centimeters in length and divides into two primary bronchi. Each one enters its corresponding lung. This is the left bronchus and this is the right bronchus. We can notice that the left bronchus is longer than the right one. It arises from the trachea by a more oblique angle, while the right bronchus is in the same line as the trachea. The place where there is a bifurcation of these two bronchi, we call it the carina. The trachea rests against the esophagus. It is kept always open because its wall is made of a C-shaped rings made of cartilage. So if we take a cross section like this in it, this is the C-shaped rings of the trachea. Posteriorly, it is closed by a muscle and connective tissue and lined from inside by ciliated mucosa. Then we have what's called the bronchial tree, and it is like a tree. It is made of a stem and divisions and branches, but in our body, this bronchial tree lies upside down. So the main bronchi divides into lobar bronchi. Each lobar bronchus will enter the corresponding loop of the lung. Then each lobar bronchus will divide into segmental bronchi for each segment of the lung. The segmental bronchi divide and get smaller and smaller and finally form the bronchioles. Also, the bronchioles get smaller and smaller to form the terminal bronchioles. The terminal bronchioles give finally the respiratory bronchioles. The lungs lie on each side of the mediastinum. Each lung is conical in shape, covered with visceral pleura, and suspended freely in its own pleural cavity. Each lung has a blunt apex, a concave base which sits on the diaphragm, and two surfaces, the costal surface and the mediastinal surface. Also, it has three borders, anterior, posterior, and inferior. The right lung is formed of three lobes, upper lobe, middle lobe, and lower lobe, separated from each other by two fissures, oblique fissure and horizontal fissure. While the left lung is made only of two lobes, upper lobe and lower lobe. They are separated from each other by one fissure. It is the oblique fissure. The anterior border of the left lung curves a little bit laterally to form the cardiac notch. Below it, part of the upper lobe extends and form the lingula. The costal surface of the lung is convex, as we can see here, and it corresponds to the chest wall, while the medial surface has the hilum in the middle, where the structures that lie at the lung root enter or exit the lung. Then we have the mediastinal part or mediastinal area of the medial surface, which lies anterior to the hilum, and vertebral surface or vertebral part of the medial surface, which is convex and lies posteriorly in the paravertebral gutters. The anterior border of the lung corresponds to the costomediastinal reflection of the pleura. It is deeply notched, as I mentioned earlier, by the cardiac notch in the left lung opposite the fifth costal cartilage. Below the cardiac notch, the anterior border extends vertically downwards to form the lingula. The inferior border of the lung is thin and sharp and corresponds to the costodiaphragmatic reflection of the pleura. It separates the base of the lung that rests on the diaphragm from the other surfaces. The posterior border, we can also call it the posterior surface, is thick and ill-defined. It fits into the paravertebral gutters and it is related to the sympathetic chains. The lung hilum, it is large depressed area nearly at the center of the medial surface of the lung. It contains the structures that pass in and out the lung via its root. So we have the main bronchus or the epiarterial bronchus on the right side as well, the pulmonary artery, two pulmonary veins, superior and inferior, bronchial vessels, they lie behind the bronchus, and also lymph vessels and nerve fibers. Here we can see the right lung and the left lung, how the structures are arranged in the lung hilum, both on the right side and on the left side. We have the main bronchus, the most posterior structure on the left side, the superior pulmonary vein, the most anterior structure, the inferior pulmonary vein, the most inferior structure, and the same arrangement lies on the right side as well. The bronchus will be the most posterior structure, the superior pulmonary vein the most anterior structure, and the inferior pulmonary vein the most inferior structure. The only change will be at the position of the pulmonary artery. On the left side it lies just above the bronchus, while on the right side it lies anterior to the bronchus. And since in the right side the bronchus divides before entering the hilum into main bronchus and epiarterial bronchus, we also can see that the pulmonary artery divides into two arteries before entering the right lung hilum as well. So we have superior division and inferior division. Also we can see inside the hilum in both sides lymph nodes and bronchial vessels. The mediastinal surface of the right lung corresponds to the right side of the mediastinum. So if this is the right side of the heart, right atrium and right ventricle, so this will give us a big depression in front of the hilum. We call it the pericardial depression. So it will be related to the right side of the heart. This will be the superior vena cava that terminates at the right atrium of the heart. So here we can see the depression for the superior vena cava. This big tube is the esophagus that lies at the posterior mediastinum and will pass behind the lung root. So we have here the esophagus that goes downward behind the lung root. If we look at the left side of the mediastinum, still we have here the heart. This will be the left side of the heart, mainly the left ventricle. So we can see in front of the hilum here the pericardial impression that is related to the left side of the heart. This is the arch of the aorta that pass above the lung root. Here we can see the impression of the arch of the aorta passes above the hilum of the lung. This will be the left subclavian artery, and as you know that we have three branches that come out of the arch of the aorta. From right to left we have the brachiocephalic trunk, the left common carotid, and the left subclavian artery. So we can see here the left subclavian artery, and this will be its impression. It will lie just in front of the apex of the lung and comes out of the arch of the aorta. Behind the lung we will have the impression for the distending thoracic aorta. Between it and the pulmonary ligament will lie the impression of the esophagus. For the blood supply of both lung and pleura, the lung and the visceral pleura will have the same blood supply from the bronchial vessels, while the parietal pleura is supplied the same as the blood supply of the thoracic wall and the diaphragm. So we have the intercostal vessels, either the posterior or the anterior, the internal thoracic vessels, which lie just behind the lateral border of the sternum, and the branches that will supply the diaphragm as the musculophrenic vessels and the superior phrenic vessels. And for the nerve supply, again, the lungs and the visceral pleura are supplied by the pulmonary plexus, which is autonomic nerve plexuses, while the parietal pleura is supplied by somatic nerves. So the costal pleura is supplied by the intercostal nerves, the same nerves that will supply the muscles of the intercostal spaces. The mediastinal pleura is supplied by the phrenic nerve, which lies on each side of the pericardium. The diaphragmatic pleura will also be supplied by the phrenic nerve, which is responsible for supplying the central part of the diaphragmatic pleura, and from the lower 6 intercostal nerves, which will supply the periphery of the diaphragmatic pleura. So in this diagram, we can make it simple. Here we have the intercostal nerves. It will supply the costal pleura and goes downward to supply the periphery of the diaphragmatic pleura, while medially we have the phrenic nerve that supplies the mediastinal pleura and also supplies the central part of the diaphragmatic pleura. And for the lymphatic drainage, we have superficial lymphatics that drain the surfaces of the lungs and deep lymphatics that drain the deep structures of the respiratory system. They first drain into the pulmonary lymph nodes, then the bronchopulmonary nodes, and then the tracheobronchial nodes, the paratracheal nodes, and lymphatics from the paratracheal nodes will collect into the bronchomediastinal trunk that empties on the thoracic duct at the left side or the right lymphatic duct on the right side. And for the surface anatomy of both lung and pleura, we start by drawing a curved line at the neck of the first strip, and then it passes behind the sternoclavicular joint to the midline at the sternal angle. It descends downward till the 6 costosternal junction, and then passes around the body wall, cutting the 8th rib at the mid-clavicular line, the 10th rib at the mid-axillary line, and the 12th rib at the paravertebral line. On the left side, at the level of the 4th costal cartilage, the line swings a little bit laterally at the cardiac notch. So here the pericardium will be exposed. The surface anatomy of the lungs follows the same pattern as that of the pleura. So it is the same as before, the only difference at the lower border of the lung. So it goes around the body wall, cutting the 6th rib at the mid-clavicular line, the 8th rib at the mid-axillary line, and the 10th rib at the paravertebral lines. Still, at the level of the left 4th costal cartilage, the line of the anterior border of the left lung swings more laterally to form the cardiac notch. The costomediastinal recess lies between the inferior borders of both the lung and the pleura. We can draw the oblique fissure of the lung as follows. We start from the 3rd thoracic spine along the medial border of the scapula when the scapula is fully abducted till we reach the 6th costal cartilage. While the horizontal fissure of the right lung, we just follow the 4th rib till the sternum. This will be the end of my presentation. Thanks for listening. If you like it, please do not forget to subscribe, like, and share. And do not forget to hit the notification bell so you can know if I upload another video. Please feel free to leave a comment below. See you in the next video. Thank you.